Okay, my absolute pleasure to welcome our next guest, Dr. Brennen Mills. He is a senior lecturer and active researcher in paramedical science and public health at the School of Medicine and Health at Edith Cowan University. He's also chair of ethics. Major research interests, though, focus on virtual and augmented reality, simulation-based learning, and pre-hospital education and interprofessional practice. You've won a few national awards, the Young Tall Poppy Award, which sounds incredible, last year, 2024, and lots of awards for his excellence in technology and social impact, so thoroughly deserved. We're really interested in the work that you're doing to enhance preparedness and confidence in responding to out-of-hospital births. It sounds absolutely terrifying to me as a neonatologist, but everything that you can do to help people at the full face in those remote environments is incredible. And you described yourself as a SEAL, happy, playful, and adaptive in both land and sea environments. And I think that's great. So we really welcome you and really look forward to hearing about your work. Dr. Brennen Mills.
Thank you so much for that introduction. I'll be happy to balance a beach ball on my nose out at coffee and stuff afterwards. I'm not going to be up here and pretend like I'm an expert in women and infants' health. We've had some amazing presenters so far that have well and truly got that covered. So I'll be coming at this through a very different lens that I hope will be of interest to some people, will pique some curiosities for people. I guess the goal of my presentation is really to get people to understand, I guess, what the opportunities are that exist through leveraging digital and immersive technologies, because that's where I come from. I'm an immersive technologies enthusiast. I've made a career of not being the clinical expert in the room, but leveraging the clinical expertise that we have across the state, across the country, in coming to me with different use cases, with different problems, and saying, this is what we've got. Brennen, how can we leverage these technologies to maybe make a difference here? So that's where I've worked with. I'm really honoured to have worked with a number of individuals and groups and we've been able to achieve great things, which is great. So yes, as mentioned, I head up the Simulation and Immersive Digital Technology Group at ECU, which is a real mouthful. We should really work on that name. But yeah, primarily we have a focus on immersive technologies with respect to education and training, primarily in the healthcare space, but we do also dabble and have done some interesting work in defence and elite sport. We typically like to focus in areas where traditional training solves or attacks an acute problem where it's highly pressurised. So again, lots of healthcare environments where we've got a lot of people doing some pretty important things where failure leads to some pretty dramatic outcomes. You can think the exact same thing with defence. Some people, like myself, being an avid AFL fan, would say the same thing about elite sport. Obviously not to the same extent. But yeah, anywhere where we can say, look, providing this kind of training is important, but it's also can be challenging, is where we can try and use these technologies. So before we go any further, I guess just to provide a bit of a definition of what we're talking about when we talk about digital simulation. So most people in the room will probably be familiar with traditional simulation-based learning environments. All clinicians have gone through different variations of simulation-based education and training across their professional careers. So an essential digital simulation is that if you can think about that traditional simulation where you may have been banging on the chest of a mannequin or anything like that, is just taking that same premise, but what can we draw out of that and incorporate into a digital environment? So that might use some really cool technologies like we've got up the back with Michelle there. Wave, Michelle, say hi. There you go. With immersive virtual reality, augmented reality, but even, computer-based simulations, mobile phone-based simulations, the medium through which the technology, kind of transfers to training is it's all that comes under that umbrella of digital simulation through the education and training lens. So what is digital simulation traditionally very good for? I get loads and loads of people coming to me with different use cases of hey, I've got this idea and I'm really interested about, what kind of digital technology we could think about with this specific application and this sort of stuff. And a lot of the conversations, can go, yep, that is a really unique and fascinating and interesting use case that we might be able to really see how the technology can make a real difference there. And others, I reckon you're going to get the same thing if you just film yourself talking on your iPhone. And that's a hell of a lot cheaper than spending, tens and hundreds of thousands of dollars on a very, very specific bespoke simulation. So it's really, really important to understand its strengths and its benefits. It's not necessarily going to be a silver bullet that's going to solve all of the problems for education and training. And a lot of people are kind of waiting for that penny to drop. I'm not really going to get involved in VR or anything like that until it can do everything. But again, then we're kind of not taking advantage of what the technology can offer now, even though there are some pretty cool futuristic applications that are happening, which I'll give you a sneak peek at towards the end of the presentation. But things like decision-making, filling that knowledge to practice gap are really where this kind of technology, I feel, makes its mark. Sometimes the really fine kind of motor skills is where digital technologies can start, at the moment, with the technology where it exists, kind of starts to fall down. But anything that really relies on or could derive a lot of benefit from that experiential learning and practice, that's where we have an opportunity with digital simulation. A great example, and we're talking about it a little bit more in the presentation, is where we first got our start was kind of like through mass casualty triage simulations with paramedics. So you can imagine, you're hiring out an airport hangar to put on this massive mass casualty simulation, but can we just replicate that in a digital environment, save all of the time and effort and money? So again, that's just an example of, it's really, really important to replicate those, but it can be really cost intensive to do that. So what doesn't work that well at the moment? Yeah, tactile feedback, technical skills, fine motor skills, and that physical skills practice. It is getting there. You've probably seen some of these cool kind of gloves that people can wear that, you're actually feeling like you're holding an apple. Great, that technology is getting there. It's still a little ways off before it's going to become, I guess, really, really accessible in the greater scheme of things. So what I thought I would do, I thought I'd just go through a few of the different kinds of digital simulations, and we can kind of get up in the complexity. And again, like I said, I'm challenging everyone here in the audience to start getting the creative juices flowing. I'd really love people to come up to me after there and say, look, I've got this concept. What do you think? How would we do it? So I'll just kind of go through the different variations and opportunities that might exist. So the most basic form of digital simulation is our screen-based or desktop simulations. These can be video-based or CGI-based. They're not particularly overly exciting. This is a piece of research that came out from ECU about work health safety digital simulation. I might get everyone, we'll do a little quick experiment here. If everyone could just put their hand in the air for me, just thank you. And now keep your hand in the air. If the last time you did your work health safety training for your organisation, you actively worked to retain that information that came through on that digital simulation. You liars. No. That's a joke. But yeah, you can see there. So this piece of research and others around it, typically this kind of digital simulation, screen-based simulation, particularly focusing on work health safety, it's about 5 to 10% of people that would say yes to that question. You can see it was actually less in this room. So, yeah, great. This kind of simulation can work well to, tick a box, and sure, we can cover our asses from a compliance perspective, and sure, we can put the blame back onto the users if they do something wrong because we've trained them. But outside of that, is it really doing what we want out of the way of people retaining information from an education and training perspective? It's cheap though. Another big tick to get this kind. Everyone's got a laptop computer, so we don't need to worry about those, how we're going to deliver on this modality. Dissemination is easy. We can just run it out online over the intranet or internet. It's self-directed. People can do it in their own time. So again, those benefits are not worthless. to get out at scale to a large group of people, there is some meaning to be derived from that. But obviously, how engaging is it, and what are people taking away from that? One of the key limiting factors is, I guess, how we're actually interacting with that environment between being a passive learner and an active learner. And you heard that word that I used before. How many people were actively thinking about, I need to retain this information? Very, very few. So it doesn't really work to kind of turn that tap on in our head to say, yep, I actually meaningfully want to retain this information. There are some things we can do to enhance the interactivity component, which, as the literature says, is an important component when it comes to digital simulation-based learning. Again, these are just some examples. You've probably all seen those drop boxes where you get words and, drop them in and out and all that sort of stuff. Sure, that can help a little bit, but really at the end of the day, it's not going to do much for us. But great, you can get a certificate at the end of it. What does the future hold for desktop scenario-based simulations in healthcare education? So the advancement potential, I'd say, is minimal. We've kind of seen everything we're going to see out of that medium. It's not going to, come and knock our socks off in the next 5 or 10 years with the types of advancements that are going on. And the adoption, hopefully, will continue to not get higher and higher because we have some much more interesting ways in which we can deliver these kind of education and trainings through digital simulation. So I'll start to get onto the more interesting stuff now. So people may have heard of this term before, serious games. What are serious games? They are games for which the primary purpose is education as opposed to entertainment. So it's a game that tricks you into learning, is the way I like to think about it. So we're leveraging entertainment-based kind of outcomes and theories in order to get you to derive meaning and learning from something. A great example, if I just click there. So what this table here, they had a whole bunch of 10-year-olds learn and apply the information derived in this chart. I'm not looking for you to actually understand what that chart is. I just want to get you to understand all of that information. 10 years later, hundreds, thousands of kids were able to take what they learnt from that chart when they were 10 years old and apply it in a meaningful way. What that chart is the dual power archetypes of Pokemon. And I can put my hand up and say I'm one of those people more like 30 years later who can still do that. So again, just goes to show you the power of games and how it works to help people retain information when they're enjoying it and they're able to apply it.
Patients ideally would be treated in the ICU with lower acuity patients.
That's all right. There we go. This is just an example for something that my team has built with Department of Health funding, which is really cool. Again, just to get your creative juices flowing. This is called the General Emergency Response Management tool. So it's all about triaging patients when there are public health emergencies going on, like a pandemic. So this was with COVID-19 emergency funding. We were able to get this. So a whole bunch of patients are kind of coming in. You've got to work to triage them into different areas of the hospital. This is designed to be a rural-based hospital. So you've got limited resources. Your oxygen is running out, your PPE is running out, your infection control supplies are running out. And as the pandemic kind of progresses in its intensity, more and more patients are coming. The spread is going on, staff are falling away. So you've got to manage and make these clinical leadership decisions in real time across the course of our pandemic. And then sure enough, the vaccine kind of starts to mitigate things and it's kind of tails off at the end. So again, just an idea of what we can do from a gamification perspective with something pretty basic from a user interface perspective. So this is up and ECU students are using this now and it's across the Department of Health as well. In certain settings, different people are taking it up. If anyone's interested to talk to me about it, I want more people to take it up. So that's a good one. This data is a little bit old now. It's a 2020, but this just gives you the kind of trajectory about serious games. This looks at just studies that were published that evaluate a serious game in a healthcare education setting. So, it's on the rise. If I was to go and, it's probably needing another updated study now, that's probably going to just continue to go like that. So there are more of these serious games in the health education context that are coming out now, which is really great. All right, so that's the serious game spiel. We'll move on to augmented reality now, which is the next kind of pretty exciting thing. I get a lot of people asking me questions about augmented reality and the opportunities that exist there. So for clarity, again, definitions are important. So when we talk about augmented reality, What that is the overlaying of digital information atop the real existing world. So the world that you're here in right now, if you're to put on a set of glasses or get your camera phone out, if there's some kind of medium between you and the real world where digital information is being overlaid, that's what we call augmented reality. So you're still existing in the real world, whereas immersive virtual reality, you're actually taken to a completely different digital world. So augmented reality has a number of cool applications. You've probably seen these things before, the Microsoft HoloLens, which Microsoft is pretty much canned now, but they are working on different things. Google's going on the Google glasses. Meta's starting to get more involved in the space now. Anatomy and physiology training is where it's probably made its biggest mark, this kind of augmented reality. But even, things like Pokemon Go, if everyone remembers that, that was the really, really simple application of augmented reality. So what is augmented reality kind of good for? Well, a good way to think about it is when you've already got pre-existing infrastructure, say in a hospital or a simulation environment. Well, if you want to leverage that infrastructure that already exists, but hey, we just want to include some digital stimuli over atop that, that is a good way that you can leverage augmented reality instead of needing to kind of necessarily create something through a digital environment from scratch. There are lots and lots of big companies investing lots and lots of money into different things with augmented reality to try and make it more accessible from a content creation perspective. So there will be a time soon where you'll just be able to open up an app on your phone and quickly build different little structures and stuff which you can then overlay atop the real world with your phone, which will be pretty cool. At the moment, though, the kind of interactive capability we have within the augmented reality environment is limited. Again, they're working on that. It is, at the moment, pretty expensive, and there aren't that many use cases I'd suggest that are really demonstrating its value. But again, the technology is coming, and I'd say it's more suitable at the moment for your more static-based kind of environments as opposed to the more dynamic things. And again, in health education, there's always, a lot going on with lots of moving parts and, people across disciplines always chatting and all that sort of stuff, which can make augmented reality a little bit of a challenge, but it will get there. And then we'll move into, I guess, where my real passion lies and where at the moment I see a lot of great capability is in immersive VR. And again, I'm going to talk about this specific application very soon. So again, just to give you some more ideas of different kind of avenues, this is a video-based immersive VR scenario, again, using mass casualty. So we got a whole bunch of actors there with a whole bunch of different ailments that they're suffering from after a car crash. And again, your job is to go through and assess and triage each of those casualties. So it can be that video-based more component of 360 immersive VR. And if anyone's wants to have a go a bit later, this is the NEONATE in VR project.
Look to confirm the airway is clear for 3 seconds and review respiratory effort. NEONATE's airway is clear.
So what this is really showing is, I guess, that kind of graphical fidelity that you can get with CGI-based immersive VR. You think it looks cool up there, actually chuck the headset on and you can see Bub in there and how realistic all the movements and the sounds and all of that kind of feel. And I guess this is a good time to transition into talking about that project specifically because this is the project that we were funded through WIRF last year, which is really, really exciting. So essentially, it is an immersive virtual reality program targeting unplanned out-of-hospital births. Highly flexible, easy to use, scalable is the big tick that we see with immersive VR. There's a series of our partners up there. And again, we're very proud to say, like this word keeps popping up in this forum, which is really, really great, is the co-design element with educators and end users, which is really, really important. But again, me not being from a clinical context, it was like, what is the problem? So this was something that was brought to us by our series of paramedic colleagues, explaining to us that, look, this is a problem. When we are called out to these what we call low-frequency, high-risk events in an obstetric case, we struggle. We're not 100% sure what to do. We're low on confidence. There's a lot of anecdotes that we were getting about people just, dumping them in the back of the ambulance and rushing them to hospital because I don't want to have to manage this clinically. There's a lot of literature out there that kind of explains the same. And there are also high barriers to training. So again, we've got very, very busy kind of clinicians, and we need to be very economic with the time that we're using for education and training. So do we sacrifice something that is both a high frequency and high risk event for something that is low frequency and high risk? Obviously, the implications of us not doing the right thing when we're confronted with this situation are not great, but it's rare. I think it's around 0.5% of cases, probably even less, I think, from memory, that actually get called to obstetric cases. So this was the problem, and we had people coming to us saying, but could VR play a role? So we went and we undertook our normal systematic and iterative user-centered development framework, which is just a fancy way of saying we've got an established pathway for how we work with our end users and our advisory groups to go through the process of developing the simulation. This was actually with Department of Health money, where we actually designed the simulation. The WIRF grant comes a little bit later. So we did a lot of work to also align these with the ARC guidelines, ambulance guidelines. And essentially where we landed was, look, one of the big areas that we can make a difference here is on the APGAR score for our clinicians in how they can actually administer that process, these clinicians in the pre-hospital environment. So now we move on to, great, we've got our proof of concept or our prototype kind of scenario in VR. Now, is it actually doing what we want it to do? Is it actually making a difference for our clinicians in the field? And this is where WIRF amazingly came in and provided some funding for us to undertake an evaluation. I provided these slides to you, Vicky, I think about 2 weeks ago, and that number was 117. I'm proud to say just over the last few weeks we've had a massive uptake, so we're now up to 176 participants that have gone through, which is really great. Big uptake across St John Ambulance WA, both from their registered paramedics, and we had lots of interest from their voluntary ambulance officers as well. And we've also got midwifery and paramedicine students going across there as well. So it took about an hour per participant. So yeah, a lot of effort going into those 176 participants, which is great. We haven't run the data yet, but the preliminary findings are better than we could have hoped, in all honesty. Enormous improvements in confidence, particularly with our less skilled individuals, say paramedic students and the voluntary ambulance officers, who really, you can just see the change of them coming out. I think we had someone just on Wednesday night who was so nervous going in, and she literally took the headset off and said, that was the coolest thing I've ever done. And then they started having a conversation, her and another colleague, saying, we could totally do that. Whereas before that she was in a position like where I wouldn't know what to do. So that was really cool. Also improvements in knowledge from what they garnered from the experience as well. High levels of system usability, which is always really good to know, because most of these people have never put a VR headset on before. So if they feel like it's clunky and it's not working, that's problematic. 99% of participants suggested they either agree or strongly disagree that they would want to do more, that they're craving more of this kind of training in VR, which is amazing. And again, big thanks to WIRF for helping us with that. It's been amazing. I just wanted to finish up. I'm sure I've probably gone over time, but just, again, back to that kind of creative juices and getting everyone understanding of the opportunities that are involved with this kind of technology. This is motion capture, and this is what we do to actually make the patients or the avatars within the digital environments really authentic. This particular application is an aggression and violence de-escalation training tool that we're working on as well, but this is just to give you that visual of how we work to get that body movement, get that facial animation working in the digital environment and what opportunities there are there. And the last one I'm going to finish on is just a different project as well, where we're actually using or leveraging AI to power these digital avatars so you can actually have a back and forth conversation. I don't think there is swearing in this one, but I'll apologise in advance if there is just a little bit, because he's actually designed as an aggressive patient that we're meant to be de-escalating. So this is a project we're working on at the moment as well. Hopefully the audio works.
What seems to be the problem?
Just this shoulder. Bit of a corker, this one. Haven't been able to get much done with it, which is, well, bloody annoying. You ever have one of those?
No, I haven't, but what seems to be the problem with your thing? Do you feel a stinging sensation?
Stinging? No, not really. It's more a constant ache, you know? Like it's trying to tell me something, but all it's saying is ouch. Makes everything a bit of a mission. You reckon I should ask for a nurse or something?
I am a nurse.
Oh, right. A nurse? Well, that's good then, isn't it? Look, I'm just not happy sitting here. This shoulder's killing me. Can you do anything?
No, I can't do anything. Go and sit down.
Sit down? But, mate, my shoulder's absolutely killing me. Sitting down is the last thing I want to do.
All right, stop it there.
What seems to be the problem?
So essentially what's happening here, this is just a demonstration of, so Charitha, our software developer, is speaking and Whisper technology is just translating that into words. That's not that impressive. Microsoft Teams does that. But then that textual response is then being put out into the world of large language models, and the AI is generating a novel response each and every time to the input that Charitha is saying. That is being brought back into the program. And you could see how quickly he was responding. His responses were starting more or less in real time. So he's actually verbalizing those responses. That's all aligned with lip animation. You could see there was some facial animation. We're working a lot harder on that. And we're now just starting to look into body animation as well. So the AI will actually be making decisions on what body animations he's employing based on the words that are coming out of his mouth. So it's pretty cool stuff. It's really cutting edge. There's lots of really high-level companies like NVIDIA that are doing a lot of work, and they're all making it open source, so we get access to it, which is absolutely crazy by them. But it's really cool. So again, just wanting to try and get people thinking about the types of opportunities that exist. I'm probably way over time, so I'll leave with this kind of quick call to action. Yeah, just again, have a think about, or I'm just challenging everyone to think about in your own context, what are the different use cases where this kind of technology could potentially play a role? I'd love to have a chat and just help you through the different options and how you could potentially leverage what this kind of applications and modalities are. The biggest limitation we see at the moment is that the really, really big organisations that are involved in VR and developing content, they're not really getting too heavily involved in the education and training space for two reasons. The first is that they're making gazillions of dollars in the entertainment space. So they're like, why should we focus on education and training when we're doing just fine over here? But the reason that they're not interested in that as kind of a vertical is because the use cases aren't really, there's not enough of them yet. So the more and more little wins we can get is when these big players are going to start to come in and say, right, there is going to be investment in this space. Everyone's talking like there will be investment, but again, it's very difficult getting health systems and large hospital systems to kind of go down this pathway. So anyway, I'll leave it there. And thank you very much.